Namaskar. Welcome in the live interactive teleconference of MBA in Healthcare and Hospital Management program. Today we are going to discuss about the accounting for managers, that is the course number 004, the MMPC, and within the course we will discuss mainly about the unit 7 and unit 10. To discuss all this issue, we have the expert Dr. Sanjiv Kumar. Welcome you, sir. And Dr. Sanjiv Kumar is graduated from AIMS in 1976. Then he served into Army, and then again he did MD from AIMS in 1994. He also did MBA in Strategic Management from the UK, and he joined UNICEF and served like Iraq, Geneva, Kenya, Malawi, Uganda, more than 33 countries he served in his period. And he was also director of IIHMR. Then he was also executive director of National Health System Resource, Government of India. And currently he is training leadership, and recently he has trained more than 1200 candidates, primarily the vice chancellors of different universities. So today I hope all you will be much benefited by the experience of Dr. Sanjiv Kumar, and we will discuss about the marginal and absorption, costing, budgeting, and budget control. And in this meantime, if anyone is having any doubt, then you are most welcome to put your questions. It may be better if you ask through phone, because YouTube questions, their numbers are very exhaustive and it is difficult to carry it out in the same time. So sir, I request you to start the sessions.
Thank you.
And we'll see how students got response out.
Thank you, Professor Biplab. It is a pleasure to come to IGNOU and take this session. I have written a few units for various courses, but it's the first time my class is being recorded. And before I start, I want to clarify to you that this session is for you. So if you have any question or any comment, please feel free to, if you want to speak up, that's fine. If you want to write it, you can write it and we will look at it and then respond to you. As Professor Biplab said, you have Unit 7 and Unit 3 in this course, which cover this topic. And some of you may be wondering, if I am health background, why I am doing health financing and these things. You know, after I did my MBA, I understood why it is important. And having worked in former communist countries of Central Eastern Europe, Central Asia, I realized that economy is very important for health. If you recall, in 1992, they had a shock therapy. You know, suddenly they moved from centrally controlled command economy to market economy, and everything went haywire, including the health system. They had one of the best indicators. These 15 countries in former USSR and Eastern Europe, their indicators for health fell down dramatically. So then, working in those countries, I realized how important it is to look at economic aspects in a country which will mar or make the health system, and health indicators depend largely on the economic system of the country. So we will be talking about marginal and absorption costing first, and then we will go to budgeting and budget control. And after giving you have lot of details in the module, and I have seen that. What I'll do is, after giving you basics, come to examples in health, how you can use marginal costing, and how do you control budget in health, and what do you do for budgeting. All of you are clear about cost? I think they have had a section on this.
Not yet, sir.
Oh, okay. So briefly, you will have a separate session on this. It is cost is any expense which is incurred during the operations for providing the good or services. In health, we mainly provide services to get the output to the customers. In our case, these will be the patients and the family. Then we have the customer, could be public, the final consumer, or another business. You may train doctors who come from other places and they go back and provide services in another institution. controlling cost is essential for success of any organization, business or services, and it has to be cost effective. In health, we always talk about cost effective intervention to improve health of the people. So we now look at absorption costing. Before that we come to marginal costing. Marginal costing is the cost accounting technique which focuses on variable cost and produces one additional unit to produce one additional unit of a product or services. For example, if you are giving immunization to a population and maybe there are 40 children and you add another village and you need to increase another 10 beneficiaries. So you will look at what is the cost which is being added by providing additional services. We'll look at introducing a new vaccine later. It helps in determining the contribution margin and assess in making decisions related to pricing, production and probability. This is where it will help. An accountant will come to you with details, but you are the boss. You will have to take a decision whether you want to produce an additional service or additional product, and how it will affect the economy, how it will impact your earning, and do you have that kind of funds. That decision you have to take. And related term is absorption costing. This is the total cost, variable cost, fixed cost and any other cost which you incur. So absorption cost is the total cost. It takes into account manufacturing of a product or a service, includes all direct indirect costs such as materials, labor, rent, insurance, software, manufacturing overheads, used for external reporting. When you have to look at how much tax you are going to pay, and these days you pay tax in advance, so you will have to look at absorption costing of the work you are doing and then calculate the tax and deposit it. You also want to look at in the private sector, look at the stock valuation, how much stock you have and how much you will probably need. This is at a glance the difference between marginal costing and absorption costing. Marginal costing is a technique in which only variable costs are assumed as product cost. In absorption costing, a technique which determines the product cost that considers both fixed and variable cost. As we said earlier, it looks at the total cost. Then are both fixed cost and variable cost considered in product cost, not in marginal cost? We discussed that it only looks at the variable cost. In absorption, yes, it looks at the both fixed and variable cost when you are looking at the costing. Nature of overheads, you look at variable cost, and also at times you look at the fixed cost, but it is variable cost you take into account for marginal costing. In absorption cost, you look at everything: procurement, distribution, production, and when you are selling a product, or in our case providing services in a hospital or primary center or a dispensary, you look at till the patient gets the medicine and goes back, you will have to consider all those costs. What does it determine? In marginal cost, it determines the cost of the next unit. We will take an example later. And in absorption cost, it determines the cost of each unit, the total cost of each unit, not the additional one unit, or as you are doing in marginal costing. Objective of marginal costing is to emphasize the importance of contributing to the product cost. In absorption costing, to demonstrate the accuracy and fairness of product. For example, cost of treatment. And this we have talked briefly. So it's fixed cost which are not influenced. For example, you are running a hospital. You are heading that hospital. So the fixed cost is you have equipment, you have buildings, you have electric supply, you have water supply and other all that will come in the fixed cost. it normally remains constant, but unless something changes substantially or something you never provided earlier you want to provide, if you want to put an MRI machine you did not have, then the fixed cost of procuring that machine will also get included, but most of the time it remains constant. Variable cost is the cost when you produce something, how much you are spending. You get the raw material. In our case, you will get medicines, you will get injectables, you will get other equipment, maybe pacemaker, you give it to the patient, implant there, and some direct labor cost. How much you are spending in providing that service to the patient. And then you have some direct energy cost. Then you have another category which is given in your module, which is semi-variable cost, where costs are not directly attributable to either the fixed cost or the variable cost. These are called semi-variable cost, and examples could be energy cost or labor cost.
Sir, in this point of view, your marginal cost and absorption cost, there are different point of view if you see, like as an administrator, or maybe from the patient's point of view as a consumer. How these things are basically influencing to both the party.
Okay. We'll take example of a hospital. You are providing services, and you are as I said earlier, you're providing services to 40 children, and you want to provide to maybe 45 children. So how much cost you are incurring? And we will look at, we have many bottlenecks in health system when we provide services, and how do we budget for that? We will come to that later. And the fixed cost is you have invested, but you are not providing services to the patient with that. Variable cost includes that, and variable costs, fixed costs you have incurred already. It is variable cost which you can influence. You can either increase or decrease. Look at how are we cost effective. If I am producing 40 children, I am immunizing. If I immunize 10 more children, what is the additional cost I am going to incur? If additional cost is less than what you give for 40 children, then you will go for it.
Sir, in this context, I think before going ahead, I think you need to explain with example the different terms commonly we use, like cost effectiveness, cost efficiency, cost benefit. These are these few particular words. I think if you explain those words, it may be better.
We will briefly talk about it. In healthcare delivery, we talk about cost benefit analysis and what cost you are incurring to provide particular benefit to a population or to an individual. Then you look at cost effectiveness. You are providing one intervention. That intervention, say, costs 50 rupees. But you have another intervention which costs 40 rupees, but gives the same result. So the unit which you are introducing for 40 rupees is more cost effective, because you want to get the most out of the money you spend. Efficiency, if your system is working to full capacity, you can maybe look after 40 patients, but you are looking after only 10 patients. So to increase the efficiency of the system, you will look at ways and means of increasing and providing those services in an efficient manner.
Sure. Thank you, sir.
Marginal cost analysis. Examine the behavior of total revenues, total costs, and operating income as changes occur in the output level, selling price, variable cost, or fixed cost. This is what is an application to health system. We call it marginal budgeting for bottlenecks. You are providing services to a geographical area. In children, the immunization coverage is 60%. You want to increase it to 90%. And then you look at what are the bottlenecks. If you address those bottlenecks, then you can reach from 60 to 90%. So after doing bottleneck analysis, then you look at how much you will be spending to address the issues which come from the bottleneck. For example, in this case, you can have lack of micro-planning for peripheral health workers. They do not have all the children who are beneficiaries and pregnant mothers on record. So you may have to help them in micro-planning. For that, what expenditure you will incur? You will have to give them training. how to do micro planning. Supervision, maybe additional supervision will be required when they are doing micro planning. You may have to give them tools, sheet of paper or software in which they can add information related to all the beneficiaries. Second is, you have shortage of supplies, like you carry vaccine in the vaccine carrier. You do not have sufficient vaccine carriers to reach out to 90% of the population. You will probably have to procure more vaccine carriers so that you can get sufficient vaccine to the field to provide immunization to 90% of children. So this is one application. You can look at other applications as well. Another example is, government is, in fact they are doing it now, is introducing HPV vaccine in the immunization program. In addition to the fixed cost, additional cold chain capacity and transportation is required, because it will add to the bulk. You have cold chain capacity to accommodate the vaccines which you are providing today. You have to look at how much volume of the vaccine will increase to be kept in a refrigerator, ice-lined refrigerator, deep freezer, or in the cold room. You have a big room in which you put the vaccine, and you also have a freezer room in which the vaccines which are to be kept at minus 20 degrees Celsius, they can be kept. So you have to calculate that. Then what will be the marginal cost? You will have to procure more vaccine, from 60% to 90%, almost 50% increase in the vaccine. You will also have to look at how much additional time the health worker is going to devote in reaching out to 90% of beneficiaries. Another factor you have to keep in mind here is, you are reaching out to different age group. Normally immunization is given usually up to 5 years, then you have a booster at 10 years and 16 years. But this will be the school age group. You will have to give vaccine to children, to girls at 11, at 15, and you have to decide how do you get. So that will also be incurring additional expenditure in reaching out to the schools. So this is one example. You want to ask anything so far on marginal costing, or we will take another example? Okay, let me take another example, and then we can discuss this and move on to the next topic. This example is about IV fluid production factory. It produces 100 pouches at the cost of 5,000 rupees. You want to produce one more pouch. So you ask your accountant to go and look at it, how much will be the additional cost. And they come back to you, for producing one additional pouch, you will spend 80 rupees. Is producing one more pouch profitable? Anybody wants to say, is it profitable, yes or no? Okay. When you divide 5,000 by 100, your cost is 50 rupees per pouch. And when you produce additional one pouch, it is 80 rupees. So it's not cost effective. So you will say, no, this is my managerial decision, we will not produce more unless we put in place system. So the additional pouch we produce will be costing less than 50 rupees. Then you will say, yes, we can produce more, so that it becomes, the total cost will come down. It's 50 rupees. If a new pouch you produce costs 40 rupees, an equal number, the cost will come down below 50. So that's how you will have to take managerial decision. Do we need to produce more, or do we keep our capacity to what is going on? So here we can talk about any application to health.
Yeah, I think this thing is applicable into many dimensions. Particularly, this is very commonly observed that when we talk about the cost benefit or those model, it is particularly we talk about only the private organizations. But in general, the health institutions which is run by the public fund, we preferably don't do any analysis, we don't give any emphasis on this. So basically, if you see right now, like the same model, if we see every district hospital now maybe having 5 PSC. Now, under this district hospital, if we are having this many PSCs operating, if we put additional PSC, because earlier norm was different for PSC,
Yes.
but now the every village the population has increased significantly. So now under the same district we need more PSC since our population has increased.
Certainly.
So if we put more PSC, will it be beneficial to the people? So can we analyze like that way, sir?
For example, in the last couple of years, we have moved from sub-center to health and wellness center. What is the change? We are addressing non-communicable diseases. Earlier, we were only looking at maternal child health and some infectious diseases. Now we are adding that. So you will need more people. So the staffing at the health and wellness center is going to be more. And then these people will coming, so some basic investigations you have to add because you are adding new condition, new diseases. So you'll need a larger waiting area. So the sub-center map, the layout plan has been expanded. So you can accommodate more patients, and then you have to have more multi-purpose workers, maybe a physiotherapist, because in old age they have a lot of issues related to bones and muscles, so they need the physiotherapy for that, and they need home care. Most of them don't need to be in the hospital, so you need to have contact with them at home. So some of your workers, maybe ashas, they will also need to be trained about non-communicable disease. And one important aspect is compliance to treatment. If you look at recent NFHS data, NFHS 5 we had, I give you example of high blood pressure. 50% of blood pressure patients do not know they have blood pressure.
Yeah.
Out of the 50%, I'm giving you round figures, out of the 50% who know they have blood pressure, only half of them have control on the blood pressure. So compliance is very important. For detection is yes important. So you pick up the patient, start treating, but you have to follow up. So health and wellness center will have to follow up on diabetes, hypertension, other endocrinal disorders. So they will have to have a contact maybe day to day to make sure that they are taking medicine. So that's my answer.
I think this is very much important dimension of the healthcare sector.
Yes. So all sub-centers in the country will be converted to health and well. I think most of them have already been converted. So you are converting the sub-center. So you got to go to the PHC, because PHC also has to provide those additional services, the medical officer there and the staff there. So every level you will have to add so that they can provide more comprehensive health services. Thanks. That's a very, very good question for us to understand how it will affect. We move on?
Yes, sir.
Okay. How marginal cost analysis helps in you as a manager? You decide if production should increase. We took an example. Pricing a service or a product. You're starting a new service, or you go and take over as a manager in a hospital, and then you look at if we are doing MRI, CT scan, are the charges enough to get over your investment? Then you will have to either change the price of the service, increase the price, and then maybe you can do well financially. Cost control, you plan how much profit. Unfortunately, even in the field of medicine, you have corporate hospitals which have come up, and people invest hundreds of crores of rupees in a hospital, and they are not concerned about patients. They probably never come to the hospital, but they are the ones who are looking at what is the return on investment I am getting. If this 100 crore I put somewhere in the share market, I will get more. So, costing and cost control have become very important, especially in the private sector. And unfortunately, 80% of patients in urban area go to private sector and 70% in rural area. So, many of you will probably land up in the private sector, or if you are not in the private sector, you will have a governance role. How much are these hospitals charging? So you have to look at that. So you need to understand these, costing analysis techniques, and marginal costing will help you in doing that. simplifies overhead. What are the overheads we are
But
using?
sir, in
Yeah.
case of the government sector, maybe they looked into the different way. Like as you said, in a private sector, they just need to the return of investment point of view. But in the government sector, when you look into the profit, maybe in terms of healthy people, they're contributing much more in the productions,
Yes.
or maybe they are consuming less health services. Those are the different variables
Yeah.
which is basically giving indicators, or maybe the variables which is strengthening the cost benefit ratio. So there is a no direct in terms of money we can say
Yeah.
okay, government has put 100 crores in the particular sector,
Yes.
particular geographical area to build this many of X number of hospital,
Right.
and after 10 years later they have found that okay, the morbidity due to the hypertension has decreased maybe 50%,
Yeah.
or maybe diabetic control has increased 20% more.
Yes.
So those are the maybe benefit which is not measurable in terms of money
Yes.
point of view.
That is true.
But the quality of life index, when we see, then if a person is working every day,
Yes.
then how much he could earn. So that point of view, through this lens, we may see and we can measure this total productions of
Yes.
these things.
Now coming back to our public health, you can divide the population into 4 groups. One is those who are absolutely healthy, and the example you are giving, let's keep them healthy. So you will have reduction in the number of diabetic cases, hypertension, cancers. Then you have second group, which are high risk. Both parents have hypertension or diabetes. You are more likely to have these conditions sometime in your life. Third one is the category which said they don't know they have the disease, so they need to be screened and they need to be tested. And earlier you pick them up, lesser will be the complications. For example, if you pick up cancer, when it is precancerous lesion in cervix or in the mouth, oral cancer, smokers have very common, those who chew tobacco. You pick it up early and you take it, patient is cured. So you need to pick them early. If you have not picked them early, they go to disease, and then you need to look at compliance. So you're very right. We need to invest more in keeping the population healthy. That's very important. Otherwise, we have already become diabetic capital of the world.
Yes.
We will become cancer capital of the world.
Every capital we are going to be
Cardiac
this way it
disease
is
capital.
going on.
So unless we work on these two groups in the population, those who are absolutely healthy and those who are with the risk factor, we will be able to have more healthy people in our population, and certainly productivity will go up. Our economy will be benefited from that.
Yeah.
So then you have stock valuation. You want to look at what is more on private sector, corporate houses, and you look at performance evaluation by getting to know marginal cost. What it does not cover, it doesn't cover all the costs. We have talked about it. It can mislead where fixed costs are high and production is low. So there it will not give you the correct picture. And then you will have to look at marginal cost per unit, which will be high, and then you will have to take a call, go beyond marginal cost, and then you will be able to get a comprehensive overview of the services you are providing. Not suitable for long-term planning, because cost is variable. That's why it is called variable cost. The raw material cost increases, the salary of the staff increases, you have more facilities, you need to expand. For example, health and wellness center are bigger than the sub-center, so you have to invest in that. So that fixed cost has changed, you will not be able to get a correct view.
Yeah, maybe like today, if we decide to build a hospital, and today maybe like 100 crores is the budget. So if the process gets extended, maybe over the period of 5 years. So today, whatever substance, maybe cement I am getting in 100 rupees, maybe that point of time it is 120 rupees at the end of the 5 years. So the cost has increased. So these are some kind of variable we need to keep in mind when performing all this.
So marginal costing will not give you idea about the cost has increased to 120. So earlier you had calculated when it was 100. So when it becomes, when looking at long term, is not a good tool for you to look at. It does not account for inventory. When you produce something, you are keeping it in the store. It's not out there in the market. You have incurred cost on that, but marginal costing does not look at it. Take-home messages about marginal cost and absorption cost. These are valuable tools to understand the cost and profits in private sector. These are useful techniques for analyzing the cost and profitability of the product or services. It helps managers take better decisions about pricing, production, and strategies for promoting your organization or your services or your products. Helps to accurately determine the impact of changes in sales volume on their profit. You produce one extra unit, we took example, it will give you an idea about that. Marginal costing cannot be looked at in isolation. So you need to look at get benefit from the whole money which is being released to the states or districts. So that is another term you will hear in your work in health.
Perhaps if we say like the automobile point of view, even if you fit the 800cc engine into this car of like Rolls-Royce, the engine capacity is the same. Even the body may be Rolls-Royce, but if the engine remains the 800cc engine, then it cannot take Rolls-Royce like as it is Rolls-Royce. It will may behave just like your certainly like 800cc like Maruti.
Maruti 800 first like it came. And you put it in a heavier vehicle, it will not be able to move. And AC will never work because all the power will go into moving the vehicle.
So the capacity need to be improved in this point of the management point of view.
Certainly.
It means like unfortunately I think this point here we need to endorse that in the MBBS curriculum we don't give them the training of management, but we expect them to perform as a MOIC of one PSC
on day one of
his passing out. So there is a unfortunate factor with this our government policy which is not in a place, and in the same time we don't give them the administrative training, we don't give them financial training, and we expect them to spend all this money whichever sanctioned to them. I think the same person became by virtue of seniority, he became the district medical officer, CMO, chief medical officer of the district. He will also behave the same because he doesn't have enough training. So the capacity, as you said, sir, like few states, since they do not have the good administrative capacity, they are not able to spend money in the district. I think these are some insight we need to keep in mind when administrating this aspect.
You are very right, and this problem you will face when you go out in the field, and you will have to find ways and means of addressing this. Then only there will be. We always say allocation to health is very low in India, but whatever is allocated is not.
They are not able to spend it.
Yes, so that is another factor we have to keep in mind. And that's why they are also taking private sector. For Ayushman Bharat, you can go up to 5 lakh rupees. You can go to a private hospital if you are a beneficiary and get services from there. So if you don't have capacity, they are
to deliver.
They are relying on private sector to provide services, and they are relatively more efficient in providing services and using the money. So now we come to budget and budget control. I want to bring you back home. How does a housewife prepare budget for a month? The husband gets a salary of maybe say 30,000 rupees. She has to look at where she is going to spend the money. Most of the time it is she who decides to spend the money. Think about it. How does she make her budget? You have, if you are renting a house, you have to pay the rent, which is like a fixed cost. Then your children are going to school, most of it is fixed cost, but then you may have to buy some new thing that will become variable cost. Then you have to, go around, you have a vehicle, two-wheeler or four-wheeler, or you have to use public transport, some expenditure on that. Then electricity and water supply, that's also a fixed cost. And then you want to add something to it. Then food and related item there. So she looks at it. If you want to buy a dining set, she will look at, no, we can't buy it this month, so let's do it next month. So she looks at what she can do with that money, and you will understand. A housewife, many of them are illiterate, but still they manage the household budget very well. So I wanted to bring you closer home so that you understand the budgeting is not something, you have to have a financial expert or something.
It is not a rocket science.
Yes, it is not a rocket science.
Every household they are doing, so all of us we can do it.
Yeah.
But we need to orient that aspect to
Yes.
ourselves. Until unless we are taking interest into it,
Yeah.
we cannot do it.
That is true. And you don't find any employee more sincere, more committed than the housewife is to the family.
For the family, housewife is the best.
Yes.
Many times these days, actually not only wife, even husband may also do the same thing.
Yeah.
But in general, Indian point of view,
Yes.
I think still they are doing very good.
Yeah. So how does she control? She looks at where are the regular expenditure. If she want to buy something in the house, if can it be done this year or can it be done next month, or when they have sufficient money, they can go for additional item. And she controls. She controls where we are spending money and how we can have money to buy certain luxuries which the family wants. Budgeting in a healthcare institution. And you have to do it every year. Usually you do budget every year. What do? You look at what are the activities we are undertaking. And if you want to add a few activities next year, you have to budget for the activities you have always been doing. And then some additional activities you want to do, you have to add that expenditure to the budget. In government institutions, most of the time it is allocated by the government. Maybe part of the funding, about 40% comes from the center, 60% or more comes from the state budget. So that money is allocated, and they have some norms for PHC, how much they should spend, and district hospital, how they should spend. But there is a flexibility. You don't pay for medicines, for example. Medicine is procured centrally, and you get it from the medical supply depot. And in many states, Rajasthan was the pioneer in this. They have digitized the whole system. You know which medicine they are going to run out, and automatically they don't wait for the indent. If they're running out of medicine, maybe a lot of fever cases, paracetamol you last for 1 month, it is finished in 15 days. So before it finishes, they look at the supply. So there are certain items on which you don't have to spend money, but they give you some funds at every health facility which are called untied fund. It's not for one activity. For example, if I remember correctly, A&M for her health and wellness center or sub-center gets untied fund of 10,000 rupees. She can get the sub-center building whitewash. If she needs to have an additional tap, she can pay for it and get it in the
maybe some kind of minor repairment or some kind of just for new activity,
yes.
some promotional activities.
Yeah.
So they have a authority to spend particular amount of money.
Yes. And if she wants to have a meeting of the women, and then maybe a cup of tea she can buy for them, and some snacks she can buy for them. So that money is given to her, and she just have to keep a record. Nobody is going to tell her, why did you spend the money there? Similarly, PHC, CHC district level, you have untied fund. Hospitals also have untied fund. So the management can decide where to use that money. So some flexibility is given. If you run out of medicine, you can buy that medicine
local purchase
from locally. Yeah, they call it local purchase. So you look at revenue and you look at operational activities. And there are two ways of coming up with the budget. We'll go into details later. One is imposed. Central government gives you money, you have to manage in that. Second type is participatory. They ask me, I go there, they discuss with me, I tell them this is the money I need, then you come to an agreement, so you are participating in the budget which is allocated to you. Zero-based budgeting in another term which is used. Zero-based budgeting is you have no money and no activity. You have activity 1, for this you need X amount of money. You have another activity, you need Y amount of money. You have routine activities, for each one of them you need the money, and you know from past how much money you need. You want to add a few more activities. you will have to cater for that. So zero based budgeting, you start with zero, and then for each activity you are going to undertake, you keep on adding money. It has to be static or flexible. Things keep changing. And if 10,000 rupees untied funds at sub-center finish, you can ask for more money.
Yeah.
And that means it is flexible. If it is that, no, I gave you all the money, you didn't do what you want to do, only next year after 6 months you will get more money. So that is flexibility, we call it. You have strategic and tactical. You have strategic is long time, tactics is both short term as well as long term. Where do I spend money so that I get the best results? Financial and operational. Operational, you are looking at activities. Financial, you are looking at finance. So you have to look at them together. But some people are good in financing. Your accounts people will be looking more at financing, and you will be looking more at operational cost. And then you can find a way out. So you consider what finance people are telling, and your responsibility of carrying out activities, you can make sure that all those activities are carried out.
Yeah, I think in this point we need to make a balance between the financial segment as well as the wellness of the people around for which the health establishment has been done.
Yes.
Maybe we may be very good into the paper, managing all this zero budgeting or whatever you are saying, but if the people are not satisfied, if the well-being of the people are not taken care, then perhaps this the main purpose is not solved. So as an administrator or as a manager, we need to keep between the balance of both the side.
Yes.
Because in the same time, people may be very happy they are these things, but in the same time, if my documents are not good, if my balance sheet is not favorable, then of course next year may be problematic for me. So I think both the way we need to take balance.
And finance people will look at only paper, how much money is coming. You are operational, you will have to look at what services are being provided, and some services need to be added, or some service you were providing has become more expensive now. So you need more money for that. So you're looking at operational aspect, but at the same time, looking at what finance people are telling, is that sufficient for your activity, is that insufficient? Because you are the one responsible. If you need more money, you have to go to higher authorities and ask for more money. A finance person will only do calculation and give it to you.
Yeah.
Unfortunately, the point you raised earlier, most of us are not trained in finance, administration, management, leadership. Who runs these aspects, administration and finance? The Babu.
Yeah.
He comes to you, says, sir, this is what you can do, and you still want to be a clinician. You spend most of your time, and then you have 10 minutes and you come and sign all the papers. So unfortunate is not the managers or people who are heading institution who are running the facilities. They are told by the Babu, and then they don't ask any question and they sign it. So the work of an organization suffers if you are not on top of it. Your department goals and strategies you can look at. So when you are doing budgeting, you make sure that your department's activities are done so that you can achieve the goal and the strategy you have put in place. The purpose of healthcare professional is to deliver high quality treatment. Why do we say high quality? Hospital acquired infection, accidents, patient who are groggy, on sedatives, they walk and they fell down, and the old man breaks his neck of femur, and then he came with a minor problem and it's become a major problem because in the hospital. So the studies range from around 12% to 40% of people get conditions which they did not come with. So it's very important for us to look at quality of care.
Hospital-acquired infections, or maybe iatrogenic.
Yeah, iatrogenic, yes.
Yeah. So we need to take care of these dimensions also.
Yes. Yeah, and you have to keep yourself updated on financial issues, on technical issues, what new programs are being put in place, how those programs are going to be implemented. You as a manager have to keep on top of it. Your purpose in a government institution not to make profit, but you want to get the best out of the money which has been given to you. And whatever activities you do, they should be taking you towards your goal. And you spend activities on the strategic aspect so that you move to those goals. When the strategy has been decided, then the budget will need to be modeled to help you meet your goals. So you have to be clear on goals. For example, you have achieve 80% coverage, or some family planning targets are given to you. And so for infectious diseases, you need to make sure that they are kept under control. So for all those, you have various strategies. And then you need to make sure that you spend on those strategies, and then you will achieve the goal. You will not achieve the goal from the money. You have to have activities and strategies so that you can achieve those health goals. You forecast. This year we spent so much of money. How much money I am going to use next year? Or maybe project for 5 years. Usually we do it for every year. We project for 5 years. But we have firm budgeting for 1 year at a time, because things keep changing. But you have your goals clear that after 5 years you want to get there. So technique is straight line. And the constant growth rate, maybe it is increasing by 5% every year, so you stick to that. It's a minimum level, and you look at historical data. Then you look at averages, you have repeated forecast.
Most of the places when we talk about the forecast and other things, we normally always, most of them they do like 10% of the earlier. You just put 10% of the earlier budget, year budget, so keep adding every places 10%, so overall you increase 10%. But it may not be necessary to do the same, because some activity may minimize and some activity may be enhanced. So the manager need to look into every activity very categorically on the basis of the priority of the or you can say demand when we talk about the market and management point of view. Maybe demand of the people, maybe demand of the situations. So they can forecast. It is not every sections you increase 10%.
You're very right. You know, this is maybe a finance person's perspective. Every year you increase 10%. You know, that is the trend from the past. But you as a manager have to see what is going to change. Are new conditions coming up on your responsibility? Health and wellness centers, for example, services are being expanded. So it cannot be a growth 5% or 10% every year. You need to look at what you need.
Some component may increase, like maybe 40% also, maybe 50% also, but some component may decrease the same amount, maybe 10%, 15%, or maybe. So that need to be examined very properly.
You have outbreaks. We just got out of COVID-19. Everything went haywire. We did not plan for it. The supplies were not there. Government put in place systems, and then the supplies came on board. You stopped providing all other services. You're focusing only on COVID. So it can go haywire. So as a professional, and what do you do for these things? You look at possible emergencies, natural disaster, earthquake, flooding, famine, excess rain, and then outbreaks. You know, you look at what has been the trend of outbreak. So you look at these various conditions, and you look at the probability. What is the probability of a disease outbreak, which maybe become pandemic? How do you cater for that? So you have to look at the possible scenarios and what is the probability, and then you prepare for it. If probability is high, then you have to be on top of it. If probability is low, yes, you will put some basic thoughts on paper, but if things do not work out, then you may change. So it's very important for you as a health professional to look at budget from this point of view. Thank you, Professor Biplab. Then you have simple linear regression. There are other statistical techniques people have been using. Then you have multiple linear regression, and you can take help from your statisticians, because finance people will not be able to help you in this. So you need help from statistician, maybe at district level or a national level, or from an academic institution. Then, you know, this is what we were saying. You have an emergency. What if earthquake comes? What if flooding happens? What if a pandemic comes,
Like maybe
disease outbreak?
earthquake.
So you keep asking those questions, and then you look at how will you cater to budgeting for that. So you have to spend time on that, and it is always a healthy exercise. It's not a theoretical exercise. Sensitivity analysis will enable you to look at different outcomes in an objective manner and work through how you might cope if things do not go exactly as per the plan. So you have to look at the coverage is not moving. You have to achieve 90% immunization coverage in 6 months. It's only 30%. So you have to see you need to accelerate effort and what you need to do in that. Budgeting is ultimately about measurement. You measure what you want to achieve. You measure how much money is required for that, and then you look at how it is doing. If you need more money, or maybe you need to cut down on activities, or if you add activities, you need more money, and that is essentially about measurement. The work of a manager, planning, all of you agree? Organizing and directing. This we teach normally in administration. Then you control, budget control. We took an example, a housewife controls the budget of the family. Then you evaluate, and then from evaluation you learn something and goes back into planning. So this cycle continuous learning, and helps you in making decisions at every stage of your work as a manager. You have long-term and short-term plans. You have to implement those plans. Then you have to see how you are doing. We took example immunization coverage. You are not on track, so you need to make additional effort. You evaluate performance, and again the cycle continues, and it helps you as a manager to take a decision. These two steps you call control. You measure performance day to day. You are seeing how are we doing, and then you evaluate performance at particular intervals, and then you see how well we are doing. Are we putting resources in the right place? As a manager, you have to take that call and take a decision to guide your staff. Budgets, we talked about it. Through the budget, you have a budget. From the budget only you will carry out activities. You want to purchase some items which are consumables on a regular basis, or some items which are long term, X-ray machine or CT scan or MRI machine. So you have to get it out of the budget you are allocated. Yes, go by the budget, and then feedback is very important. You are continuously looking, yes. Yeah. Feedback is very important, and we continuously look at that, and if needed, we revise. Budget is a quantitative expression of a plan of action, a detailed plan for acquiring and using financial and other resources over a specified period of time. You do it for 1 year, 2 years, or 5 years. So 1 year is called tactical plan, and 5 years is called strategic plan, long term. You are looking at future. That is what is called strategic. And this is some activities which you do in strategic planning. Long term budgets, usually more than 1 year we call more, and their forecasting becomes important. You look at assets you want to acquire, and financial plans. If things change in future, how we are going to use your finances or add financing. Research and development is a part of your plan. Short term, usually we look at 1 year. So services you want to provide, how many people you want to handle, and the supplies which you need to acquire. Then we talked about imposed, comes from the center. You have no say. Then participatory, people talk to you, and then you take a call, and with your bosses you agree on how much money is going to come. You have right to comment before the budget comes. For example, NHF budget, the states put up what is called program implementation plans, PIPs, and then they discuss with the with the authorities in the Ministry of Health who control the budget. And after discussion, then they come to an agreement, and if the budget is cut down, then they decide on which activities can be left out so that they can manage in those activities. Take home messages. Budgeting is an important part of the management of any department or any organization. Even if you do not have experience of financial management or indeed a head for head numbers, it is important. You know, you're not good at numbers, you don't have financial experience, but it's very important for you to understand the basics so that you can manage your organization well, and that comes from the money you spend, any money you get. The budgeting process will ultimately affect the outcome of the department and the people around you who are part of your team and help you in achieving your goals. Thank you.
Yeah, I think this is very important topic, and the way it was described, I hope all the students must be get benefited out of it. Sir, can we have some questions? If
yes,
you
please.
Just minimize it and look into
okay.
Minimize and look into the YouTube. So that we can have a 1 minute time.
Yeah, sure.
If some questions are putting
YouTube,
you put a scroll down, sir. You just click the Chrome icon, it will arrive on the top.
Here.
Yeah, on the top.
Okay.
Chrome icon.
I am semi-literate when it comes to technology.
It is
open?
No. Yeah, open.
Okay.
No, it is already there. Anyway, I hope we are sincerely thanked to Dr. Arvind for these wonderful discussions, and we are also expressing our gratitude towards the team of EMPC who is helping us to broadcast this program, and all the students who are viewing this program. The same program will be telecast at 8 p.m. today, so you can also watch at the Gyan Darshan channel. And we'll have another sessions on the next week, that is on 28th of November. Till now, thank you very much for viewing us. Thank you.
Thank you.
Namaskar.